So fertility is a huge, huge concern, and I would say that it's one of the things that has the potential to cause a lot of distress, and that distress is not necessarily so much at diagnosis or during treatment, although it can be, but I think often in my experience it can be after treatment's done, or even, you know, down the track when young people might realise, oh gosh, like my treatment actually had an impact on my fertility, and I maybe didn't fully process that or didn't fully realise that at the time. I think fertility is a really tricky thing for a lot of reasons. So from a medical standpoint, you know, there can be, everyone's situation is different, and there can be reasons why it's not possible, or there's not time to really talk about it or kind of do fertility preservation properly before treatment. Or there might be tricky situations where a patient might need to choose between, you know, doing fertility preservation and delaying treatment a little bit, or starting treatment straight away. I think it's really, really important that people have the conversation though, because I think in my experience, what can be the most upsetting for young people is when they later realise, even just through, you know, Googling or things like that, realise that there's potential fertility implications of their cancer treatment, and they maybe don't feel like it was talked about enough, they don't feel like they understood it enough at the time, that they were informed, and that can be, I guess, doubly hurtful then, because then there's the worries and the distress about, gosh, am I going to be able to have kids? And those kinds of worries. And then there can be the distress around, like, you know, maybe I feel a bit angry or upset that I don't feel like this was talked about well enough at the time.